Welcome to Damal Consult Career Academy. In today's video, we'll be discussing NHS Therapy Assistant interview questions and answers to help you pass your NHS interview with confidence. Whether you're preparing for your first NHS Therapy Assistant role or looking to advance your career, this video will provide you with the most commonly asked questions and expert tips on how to answer them effectively. Make sure to watch till the end to get the full benefit of these insights. Let's get started. 1. Can you tell us about yourself and why you want to be an NHS Therapy Assistant? I am a dedicated and compassionate healthcare professional with a strong background in providing patient-centered care and support. Throughout my career, I have developed hands-on experience in assisting individuals with mobility, rehabilitation exercises, and daily activities, ensuring they receive the best possible support for their recovery and overall well-being. My ability to work closely with patients, understand their needs, and provide both physical and emotional support has been a crucial part of my role. One of my strengths is my ability to communicate effectively with both patients and multidisciplinary teams, ensuring that care plans are followed accurately and patients receive consistent support. I have worked in fast-paced environments where adaptability, patience, and empathy are essential in delivering high-quality care. I take pride in my ability to reassure patients, encourage their progress, and support their families by providing clear information about their loved one's rehabilitation process. My motivation for becoming an NHS Therapy Assistant stems from my passion for helping people regain their independence and improve their quality of life. I find it incredibly rewarding to assist patients in their journey toward recovery, whether it be through guided exercise programs, assisting therapists in treatments, or simply offering encouragement. I am particularly drawn to the NHS because of its commitment to providing high-quality, patient-focused care to all individuals, regardless of background or circumstance. The opportunity to be part of a structured, professional, and collaborative environment where I can contribute to patients' rehabilitation is something I deeply value. Additionally, I am eager to continue developing my skills and knowledge within the NHS, taking advantage of training opportunities and working alongside experienced healthcare professionals. My goal is to expand my expertise in therapy assistance, learn advanced rehabilitation techniques, and enhance my ability to support patients more effectively. I am also keen to gain further certifications and qualifications to enhance my contribution to the team. Beyond my technical skills, I bring a strong work ethic, a patient-centered approach, and a commitment to upholding the NHS values of compassion, respect, and dignity in care. I understand the importance of treating each patient as an individual, tailoring support to their specific needs, and creating a positive and encouraging environment to facilitate their recovery. I believe my experience, dedication, and enthusiasm for patient care make me a strong candidate for this role, and I am excited about the opportunity to contribute meaningfully to the NHS and the lives of the patients I will serve. 2. What do you know about the role of a therapy assistant within the NHS? A therapy assistant within the NHS plays a crucial role in supporting qualified therapists, such as physiotherapists, occupational therapists, and speech and language therapists, in delivering high-quality care to patients. The role involves both clinical and administrative duties to ensure the smooth running of therapy services. Therapy assistants help patients regain independence by assisting them with exercises, mobility support, and therapeutic activities under the guidance of a registered therapist. They also provide emotional encouragement and ensure patients feel comfortable and motivated during their rehabilitation. Additionally, the role includes preparing treatment areas, setting up equipment, and maintaining accurate patient records. Therapy assistants may also educate patients and their families on exercises or techniques to continue therapy at home. A strong focus on teamwork is essential, as therapy assistants work closely with therapists, nurses, and other healthcare professionals to deliver person-centered care. They must also adhere to NHS policies, including infection control, safeguarding, and confidentiality regulations. Overall, this role requires compassion, good communication skills, attention to detail, and the ability to support patients with diverse needs in a healthcare setting. 3. How would you support a therapist in delivering treatment to patients? As an NHS therapy assistant, my role in supporting a therapist in delivering treatment to patients would involve both direct patient interaction and administrative support to ensure smooth and effective therapy sessions. In my previous role, I worked closely with healthcare professionals to assist in patient care, ensuring that therapy sessions were well organized and that patients received the best possible support. I would begin by preparing the treatment area, ensuring all necessary equipment is set up and ready for use. This might include arranging mobility aids for physiotherapy sessions or setting up materials for occupational therapy activities. During the therapy session, I would assist patients by demonstrating exercises under the therapist's supervision, providing encouragement, and ensuring they follow instructions safely. If a patient struggles with mobility or coordination, I would offer physical support while maintaining their dignity and independence. I would also carefully observe their responses and progress, reporting any concerns to the therapist. Beyond direct patient support, I would also help with administrative duties such as maintaining accurate records of patient progress, updating reports, and ensuring all documentation complies with NHS confidentiality and GDPR guidelines. Additionally, I would contribute to patient education by reinforcing therapy instructions and helping patients practice exercises between sessions. My ability to communicate effectively with both patients and healthcare professionals, combined with my commitment to providing compassionate care, ensures that I can support therapists in delivering high-quality treatment that meets each patient's individual needs. Before we proceed further in this video, if you're preparing for an NHS Therapy Assistant interview, I've got something that will save you time, boost your confidence, and increase your chances of success. I've put together a detailed ebook titled NHS Therapy Assistant Interview Questions and Answers. Inside, you'll find 50 carefully selected interview questions for NHS Therapy Assistant roles, sample answers that reflect NHS values and show your communication, empathy, and teamwork skills, practical advice for value-based and scenario questions. And great news, it's currently available at a 50% discount. Click the sealer or fourth wall link in the description to download your copy instantly. It's affordable and packed with everything you need. For any help or questions, feel free to message us on WhatsApp or send an email. Now let's get back to the video. More NHS Therapy Assistant interview tips are coming right up. 4. Can you describe a time when you had to communicate effectively with a patient or colleague? In my previous role as a healthcare assistant, I worked with a patient who was recovering from a stroke and had significant difficulty speaking and expressing their needs. This situation required me to communicate effectively and patiently to ensure the patient received the right care and support, while also maintaining their dignity and comfort. To facilitate better communication, I used a combination of active listening, body language, and simple yes, no questions to allow the patient to respond without feeling overwhelmed. Recognizing that verbal communication was a challenge, I also introduced a communication board with basic words, symbols, and pictures, enabling the patient to point to their needs, such as water, assistance with mobility, or pain relief. Additionally, I collaborated closely with the speech and language therapist, who provided specific techniques to aid communication. I learned how to slow down my speech, use gestures, and confirm my understanding by repeating what I thought the patient was trying to convey. This ensured that we minimized miscommunication and provided the best possible care. Beyond direct patient interaction, also maintained clear communication with colleagues, ensuring that all team members were aware of the patient's specific needs and preferences. I updated nurses and therapists regularly on any progress or changes, allowing for a more coordinated approach to care. By being patient, adaptable, and compassionate, I helped the patient feel heard and respected, which significantly reduced their frustration and improved their overall well-being. This experience reinforced my belief in the importance of effective communication in healthcare, and demonstrated my ability to adapt to different patient needs while working collaboratively with the wider team. 5. What steps would you take if a patient was struggling to follow therapy instructions? If a patient was struggling to follow therapy instructions, I would take a patient-centered and compassionate approach to support them while ensuring their safety and progress. First, I would assess the situation to understand why they are struggling. This could be due to physical discomfort, cognitive difficulties, language barriers, or a lack of motivation. I would observe their response to the therapy and ask open-ended questions to identify any specific concerns or challenges they may be facing. Next, I would adapt the approach based on their needs. For example, if the instructions were too complex, I would simplify them or break them down into smaller, manageable steps. If they were experiencing pain, I would reassure them, encourage them to communicate their discomfort, and, if necessary, seek guidance from the supervising therapist to adjust the therapy plan. If language or communication barriers were an issue, I would use visual aids, demonstrations, or gestures to reinforce understanding. In cases where the patient seemed unmotivated, I would provide encouragement, explain the benefits of the therapy in a way that resonates with them, and set realistic, achievable goals to boost their confidence. Throughout the process, I would remain patient, empathetic, and supportive, ensuring that the patient feels heard and valued. If their struggles persisted, I would report my observations to the therapist, so that we could collaboratively adjust the treatment plan to better suit their needs while maintaining their well-being and progress. 6. How do you handle stressful situations or challenging patients? Handling stressful situations and challenging patients is a key part of being an NHS therapy assistant. In my previous role, I encountered various situations where patience, adaptability, and strong communication skills were essential. When faced with a stressful situation, I remained calm and focused on the needs of the patient. For example, I once worked with a patient undergoing rehabilitation who became frustrated and resistant to therapy exercises. Instead of reacting to their frustration, I took the time to listen to their concerns, acknowledge their feelings, and adjusted the approach to make them feel more comfortable and in control. By offering encouragement and breaking down tasks into smaller, manageable steps, I was able to regain their trust and motivate them to continue with their therapy. In high-pressure situations, such as handling multiple patients with different therapy needs, I prioritize tasks effectively, follow protocols, and communicate with the team to ensure smooth coordination. I also recognize the importance of self-care and stress management techniques, such as deep breathing and seeking guidance from colleagues when needed, to maintain professionalism and deliver the best care possible. Overall, my ability to stay composed, show empathy, and adapt my approach to different patient needs allows me to handle challenging situations effectively while maintaining a high standard of patient care. 7. What experience do you have working with individuals who have disabilities or mobility issues? In my previous and current roles, I have gained extensive experience working with individuals who have disabilities and mobility issues. I have provided hands-on support to patients with a range of conditions, including physical disabilities, neurological disorders, and age-related mobility challenges. One of my key responsibilities has been assisting individuals with daily living activities, such as transferring from beds to wheelchairs, assisting with personal care, and ensuring they can move safely within their environment. I have also worked closely with physiotherapists and occupational therapists to support patients with mobility exercises and rehabilitation programs, encouraging independence while ensuring their safety. For example, I once supported a patient recovering from a stroke who had significant mobility limitations. By following the therapy plan, using safe manual handling techniques, and providing emotional encouragement, I helped the patient gradually regain confidence in walking with assistance. This experience reinforced my ability to be patient, empathetic, and adaptive to individual needs. Additionally, I am trained in the use of mobility aids such as hoists, walkers, and wheelchairs, ensuring that patients receive the appropriate support to move comfortably. My experience has taught me the importance of treating each patient with dignity and respect, while tailoring my approach to their specific mobility challenges. Overall, my hands-on experience, combined with my commitment to patient-centered care, makes me well-equipped to support individuals with disabilities and mobility issues in a therapy assistant role. 8. How would you ensure patient confidentiality and maintain professional boundaries? Ensuring patient confidentiality and maintaining professional boundaries are essential aspects of my role as an NHS therapy assistant. I would achieve this by strictly following NHS Scotland's policies on data protection, confidentiality, and professional conduct. I would always handle patient information with discretion, ensuring that any discussions about a patient's condition or treatment take place only in appropriate settings and with authorized personnel. I would adhere to GDPR guidelines by securely storing written records, refraining from sharing patient details with unauthorized individuals, and using NHS-approved communication channels for patient-related information. To maintain professional boundaries, I would ensure that my interactions with patients remain respectful, appropriate, and focused on their care. I would be compassionate and supportive while maintaining a professional distance, avoiding personal involvement or favoritism. If a patient shares personal concerns beyond my role, I would direct them to the appropriate healthcare professional for support. Additionally, I would regularly participate in training on confidentiality and ethical conduct to stay updated on best practices. If I ever faced a situation where confidentiality or professional boundaries were at risk, I would seek guidance from my supervisor or follow the NHS's escalation procedures to address concerns appropriately. 9. Can you describe a time when you worked as part of a team to achieve a goal? In my previous role as a caregiver, I worked as part of a multidisciplinary team to improve the mobility and independence of an elderly patient recovering from a stroke. The goal was to support the patient's rehabilitation by following a structured care plan designed by the physiotherapist and occupational therapist. My role involved assisting the patient with prescribed exercises, ensuring they were comfortable and motivated, and monitoring their progress. I also worked closely with nurses to ensure the patient received proper nutrition and pain management. Additionally, I maintained clear communication with the team by reporting any changes in the patient's condition, which allowed adjustments to the care plan when necessary. Through our teamwork, the patient gradually regained strength and was able to transition from using a wheelchair to walking short distances with assistance. This experience reinforced the importance of collaboration, effective communication, and consistency in patient care. I take pride in working as part of a team to achieve positive outcomes, and I believe this approach would allow me to contribute effectively as an NHS therapy assistant. 10. What do you think are the most important skills for a therapy assistant, and how do you demonstrate them? The most important skills for a therapy assistant include strong communication, empathy, teamwork, adaptability, and attention to detail. These skills ensure effective patient care, smooth collaboration with healthcare professionals, and adherence to treatment plans. In my current role, communication is key when assisting patients with therapy exercises and ensuring they understand instructions clearly. I always speak in a calm, reassuring manner and adapt my communication to suit the needs of each patient. Whether that involves simplifying instructions or using non-verbal cues. Empathy is essential in providing patient-centered care. I demonstrate this by actively listening to patients' concerns, offering encouragement, and providing emotional support, especially when they feel frustrated or anxious about their progress. Teamwork plays a significant role in my daily responsibilities. I work closely with physiotherapists, occupational therapists, and nurses to implement treatment plans effectively. For example, I assist with mobility exercises, ensuring patient safety while following the therapist's guidelines. Being adaptable is crucial, as each patient has unique needs and recovery progress. I adjust my approach based on the patient's condition, whether that means modifying exercises or offering alternative support strategies. Lastly, attention to detail ensures that I accurately document patients' progress and report any concerns to the therapy team. For instance, if a patient struggles with a certain movement, I relay this information promptly so their treatment plan can be adjusted. By demonstrating these skills daily, I contribute to a safe, supportive, and effective therapy environment, ensuring patients receive the best possible care. Do you have any question for us? Here are 5 thoughtful questions you could ask at the end of your NHS Therapy Assistant interview. 1. Can you describe a typical day in this role and how the therapy team collaborates with other healthcare professionals? 2. What support and training opportunities are available to help therapy assistants develop their skills and progress in their careers? 3. How does the department ensure that therapy services are patient-centered and aligned with NHS Scotland's core values? 4. What are some of the biggest challenges facing the therapy team, and how can a therapy assistant contribute to overcoming them? 5. What are the next steps in the hiring process, and when can I expect to hear feedback on my application? These questions demonstrate your enthusiasm, interest in professional growth, and commitment to patient care. That brings us to the end of today's video on NHS Therapy Assistant interview questions and answers. I hope you found these tips helpful in preparing for your upcoming interview. Remember, confidence, preparation, and a clear understanding of the role will set you apart. If you enjoyed this video, don't forget to like, subscribe, and hit the notification bell so you never miss out on more career tips. Also, drop a comment below if you have any questions or need further guidance. Good luck with your NHS interview, and I'll see you in the next video.